Hi, everyone. We're the Mental Health and the Justice System in Durham County project team. Our team is using data from the Duke Health System and the Durham County Detention Facility. This data includes bookings, which are when someone is registered into the jail system, encounters, which is any contact an individual has with Duke Health, and an individual's costs at Duke Health.
Our team had two initial research questions. The first question was, what is the effect of jail on an individual's mental health status? So this is a causal question. So for our preliminary results, we looked at the prevalence of mental illnesses before and after incarceration and found that our evidence suggested that among a population of people who undergo incarceration, the likelihood of being diagnosed with a mental illness is greater post-incarceration than pre-incarceration. We conducted this analysis using a McNamara test, which is a modified chi-square that takes into account paired samples. We further found that spending any time in jail increases the odds of being diagnosed with a mental health condition post-incarceration, with the longer times one was in jail having a stronger effect. So as you can see from this coefficient plot, as the time one spends in jail increases, there's a larger and larger chance of developing a mental health condition post-incarceration.
Second part of our analysis was descriptive in nature. We wanted to see how much cost at Duke Health formerly incarcerated people with mental illness incur, and if there are more cost-effective ways to care for people in this population. To start our analysis, we had to consolidate the cost data into a format that was actually usable. From there, we had to make the cost data compatible with the encounters, which is the medical data, and the bookings, which is the jail data. From there, we added identifying flags to indicate mental illness status, appointment type, that would allow us to easily filter in the future to perform descriptive analyses. For our results, we ended up creating two data sets, one that was consolidated by hospital account ID and one that was consolidated by encounter ID for further analysis. We also began with some descriptive analysis, and we created a density plot of Duke Health costs based on a person's mental illness status faceted by the number of bookings. This was that plot. As you can see, as bookings increase and as severity of mental illness status increase, the variability in the cost data increases.
So regarding next steps, our next steps for our first analysis question is to look at how to take a more detailed look at how the amount of time in jail affects the odds of developing a mental illness, as well as the number of booking instances affects one's probability of developing a mental illness.
And with the cost data, we want to use the data sets that we created to answer the questions, what proportion of Duke Health cost is public cost, and what proportion of Duke Health cost is incurred by familiar faces, which are anyone who's had more than 5 bookings in a year. And we wanted to thank all of our partners, and thank you so much.